My fellow Sierra Leoneans, our country is currently faced with an existential threat due to the ravaging impact of drugs and substance abuse, particularly the devastating synthetic drug, Kush. We are witnessing the destructive consequences of Kush on our country's very foundation, our young people, in spite of our government's effort to stop the proliferation of drugs and substance abuse in Sierra Leone. This deadly Kush, which knows no boundaries of class, ethnicity, gender, or religion, is taking a devastating toll on our communities, tearing apart families, and robbing us of our future leaders. The deterioration and alarming mortality rate of our young people due to the addictive use of Kush is no longer acceptable. As a government, we say enough is enough. As a nation, we say enough is enough. Synthetic drug and substance abuse is a global crisis. Sadly, its harmful effects have reached our doorsteps. Our young people are becoming increasingly addictive to Kush, which has become a death trap. Our government remains fully committed to combating drug and substance abuse in all its forms and protecting the well-being of our citizens, particularly our youth. In the past, I constituted a presidential task force on drugs and substance abuse to help fight drugs and substance abuse in our communities. We are making concerted efforts to combat this menace, but unfortunately, we are experiencing a surge in Kush consumption and escalating fatalities among its users. It is my solemn duty as your president, acting on the powers conferred on me by the Constitution, to declare a national emergency on drug and substance abuse. With this national emergency on drug and substance abuse, we shall broaden the scope of the government task force's work and adopt a multifaceted approach to addressing the increasing Kush epidemic. Our fight against Kush should be a collective effort, which is why I have directed the setting up of a national task force on drugs and substance abuse, with a particular focus on combating the rising Kush crisis. The national task force will be multisectorial, comprising key government ministries, departments and agencies, security and law enforcement agencies, community organizations, non-governmental organizations, development partners, religious organizations, and recovering people with substance use disorder to address drugs and substance abuse through a comprehensive strategy. The National Task Force will be responsible for implementing a 5-part strategy for a drug-free future, which includes 1. Prevention. This includes awareness campaigns, promoting healthy alternatives, and deterring drug use. 2. Care and treatment. In every district, we establish accessible treatment centers that are adequately staffed by trained professionals to offer care and support to people with drug addiction. 3. Social services support. This is to provide comprehensive recovery services such as counseling, skills training, and reintegration programs. 4. Law enforcement. We dismantle the drug supply chain through investigations, arrests, and prosecutions. 5. Community engagement. Partnering with communities will be crucial in our fight against Kush. This strategy will encompass all sectors of society and will be replicated at the chiefdom, township, and district levels. Given the national emergency on drug and substance abuse, a presidential advisory team will supervise the national task force in our quest to eradicate Kush and other lethal drugs in our communities. In the coming days and weeks, the National Task Force will dialogue with the public about its core mandates and objectives. I encourage all citizens and residents in Sierra Leone to embrace our fight against Kush fully. Fellow Sierra Leoneans, in my New Year's Day address, I highlighted the immense investment we have made as a country in human capital development. Today, it is pleasing to know that we have more children in school, particularly girls, than at any other time in the history of this country. We have reduced the maternal mortality rate by 61% and expanded healthcare coverage to our people. We continue to make modest investment in infrastructure, such as energy access, transportation networks, and internet coverage. As a nation, we can only continue to make such investments and progress in a stable and healthy environment. Today, Sierra Leone faces a critical public health emergency due to drug and substance abuse, particularly the lethal synthetic mix known as Kush. As part of our decisive action to combat this menace, our government shall intensify and ramp up efforts to educate our young people about the dangers of drug abuse. Through school programs, community outreach, and media campaigns, we will empower our youth with the knowledge and skills they need to make healthy choices and resist the temptation of drugs. Of course, we understand that addiction is a health-related challenge. That is why we are investing in rehabilitation and treatment facilities to provide support and care for those struggling with addiction. It is not enough to punish drug users or people with addiction. We must also offer them a path to recovery and redemption. Our human capital development agenda and our sustained efforts to move the country to middle income status by 2039 will come to naught if the largest base of our population, the young people, are being ravaged by Kush. We are therefore intensifying efforts to create more jobs through our big 5 development priorities, especially through the flagship Fit Salon initiative and the Youth Employment Scheme. By creating more jobs, we will be shutting down one of the biggest breeding grounds for addiction, which is idleness or unproductivity. At the same time, I say to anyone who is involved in the production, trafficking, and illicit trade of these drugs that your time is up. There shall be no sacred cows in our quest to decisively deal with those who are caught in the act of peddling these drugs in our country. We are strengthening our law enforcement efforts to crack down on drug trafficking and distribution networks. We will work tirelessly to disrupt the supply chain that fuel this epidemic and hold those responsible accountable for their actions. We would also empower our judiciary to act decisively and prioritize drug-related cases so that anyone arrested for the shipment, production, and illicit trading of the chemical components and final synthetic drug will be tried with the full weight of the law. But our fight against this epidemic cannot succeed solely through government actions. It requires the collective effort of every citizen, every community, every sector of society. We must come together as a nation to support one another, to look out for our neighbors, and to build a future where our youth can thrive free from the grip of addiction. Together, let us all say no to Kush. To our youth, I say, you cannot waste your youthful vigor on the altar of death-bound pleasure. Sierra Leone awaits your contribution towards solving some of the multitudes of challenges plaguing her. Fellow citizens, we must collectively rise to this challenge, as we have done in the past, to confront other epidemics like Ebola, rape, and COVID-19 in recent times. We must work together with courage, determination, and compassion. Let us stand united in our resolve to overcome this epidemic and build a brighter, drug-free future for generations to come. To every parent and family that has lost a loved one to Kush, we are in this together, and we will fight to stamp out this deadly substance from our national consciousness. May God bless Sierra Leone and guide us in our effort to protect our people and our nation. Thank you.